war, you do not make soldiers unhappy. Travel the extra mile and channel some extra money to address their grievances, said the Supreme Court on Friday, taking serious note of non-payment of salary and lack of proper accommodation to doctors engaged in the fight against COVID-19. The courts should not be involved in the issue of non-payment of salary to healthcare workers, and the government should settle the issue, it said. The top court was hearing a plea by a doctor who alleged that frontline healthcare workers engaged in the fight against COVID-19 were not being paid salaries or the salaries were being cut or delayed. The doctor also questioned the centre's new SOP, making the 14-day quarantine non-mandatory. The bench posted the matter for further hearing next week. On June 4th, the centre had told the top court that a large number of makeshift hospitals will have to be built in the near future to accommodate the constant rise in the number of newly infected people. The centre also contended that though hospitals are responsible for implementing the infection prevention and control activities, the final responsibility lies with the healthcare workers to protect themselves from COVID-19. It further said mandatory quarantine for 14 days after the duty of healthcare workers of 7-14 days is not justified and warranted. On April 8th, the Apex Court had already observed that the doctors and medical staff are the first line of defense of the country and the battle against COVID-19 pandemic, and directed the centre to ensure that appropriate PPEs were made available to them for treating the coronavirus patients.